Hi, I'm Dr. Athre with Athré Facial Aesthetics in Houston, Texas. The purpose of this lecture is to discuss the role of septoplasty. As you do research into a rhinoplasty, you're going to notice the term septoplasty. What is a septoplasty? Why is a septoplasty done? How is a septoplasty done? These are some of the things that we're going to answer in this talk. As was noted in one of my prior talks, the septum is the primary tent pole of the nose. It is the primary cartilaginous structure that gives support to the nose. Now, the septum can be deviated or crooked due to a number of reasons. Number one, most commonly, trauma. However, sometimes it's just due to genetic causes. Whatever the rationale for the deviation of the septum is somewhat unimportant. However, if the patient requires or desires a rhinoplasty, it is important to address the septum at the same time as the rhinoplasty. Why is this? The rationale for this is as follows. If the septum is the major tent pole of the nose and you open structures and you try to make it look very aesthetically pleasing and don't address any underlying deviation of the septum, there's a high probability that the long-term result of this rhinoplasty could be warped or crooked. For that reason, to ensure the straightness of the nose, ensure adequate tip support, and adequate support of the entire nose, it is important to address the septum. When a patient has a simple septoplasty done, what does that mean? Many times a patient will see an ENT because they have breathing difficulty. If the ENT assesses their nose and finds the septum to be deviated, a small portion of the cartilage may be removed during a septoplasty. This type of procedure can take anywhere from 30 to 45 minutes done in the operating room. However, the problem is that the cartilage that has been removed is not replaced back in the nose. Hence, there is actually some loss of tip support during this type of procedure. If the patient desires a rhinoplasty down the road, the rhinoplasty is going to be more difficult because of the fact that some of the cartilage has been removed, some of the mechanisms to support the tip are now deficient, and last of all, there's going to be some amount of scarring in the area due to the fact that that area has been instrumented before. This is the primary reason that I believe a septoplasty should be performed at the time of the rhinoplasty to avoid these issues. If you have any other questions with respect to septoplasty, rhinoplasty, the differentiation between the two, or any other type of questions addressing rhinoplasty, please don't hesitate to call us or look us up on RealSelf, Athre Facial Aesthetics, www.athrefacialplastics.com.